It can feel frustrating when you've already worked on diet, stress management, sleep, yet your antibodies remain high. And that's often the point where people start searching for hidden triggers. And dental health is one area that comes up again and again. Have you ever wondered if something like your dental work, mercury fillings, or root canals might be keeping your thyroid antibodies elevated? I had patients who hit a roadblock until they did address their oral health. Over the years, I've had many people with mercury amalgams and root canals work with me, and some of these people ended up removing their amalgams and or root canals. So mercury amalgams are also known as silver fillings. They actually are a mixture of metals, which consists of approximately 50% mercury and a powdered alloy composed of silver, tin, and copper. And as far as the impact of mercury on the immune system, the release of mercury vapor when chewing or drinking hot liquids could potentially stimulate the immune system. So there is evidence that it can affect the thyroid directly. So it's not just about the immune system and autoimmunity. So mercury can cause problems in multiple ways. Root canal, which is just removing the nerve but leaving the tooth in place. And the concern is that potentially the bacteria remain trapped and over time can create chronic low-grade inflammation, affect the immune system. So to give you a better picture, we'll look at a few different areas. First, I'll discuss what mercury amalgams actually are and how they can potentially influence the immune system. Second, I'll also discuss root canals, how potentially they can contribute to chronic low-grade infections, why some practitioners think this could keep the immune system overactive. And third, how understanding these possible triggers, how they fit into the bigger question so many people face. How do you know when to keep exploring natural approaches and when may it be time to consider other options for addressing your antibodies? But before I talk about concerns with mercury amalgams and root canals, I want to mention that over the years, I've had many people with mercury amalgams and root canals work with me. And while some of these people ended up removing their amalgams and or root canals, this certainly hasn't been the case with everyone. And the point I'm trying to make here is that while poor oral health can prevent some people from healing, it's certainly not impossible to heal if you have mercury amalgams or root canals or both of these and you choose not to remove them. It really depends on the person. On the other hand, I have had patients who hit a roadblock until they did address their oral health. So with that being said, let's go ahead and talk a little bit about mercury amalgams. So mercury amalgams, they are also known as silver fillings. And the reason for this is because they have a silver appearance, but they actually are a mixture of metals, which consist of approximately 50% mercury and a powdered alloy composed of silver, tin, and copper. And as far as the impact of mercury on the immune system, the release of mercury vapor when chewing or drinking hot liquids could potentially stimulate the immune system. Also, there is evidence that it can affect the thyroid directly. So it's not just about the immune system and autoimmunity. So mercury can cause problems in multiple ways. Not too long ago, I discovered that mercury, like many other toxins and toxicants, can increase permeability of the gut. And we have that triad of autoimmunity, genetics, environmental triggers, leaky gut. So mercury can cause that leaky gut component, or at least be one factor. I mean, there's so many different things that can cause a leaky gut. But even if you've had mercury amalgams for many, many, many years, like 20, 30 years, which is certainly the case with some people, sometimes even longer than that, still can be causing problems. But again, not everyone is affected equally. There's some people that live with amalgams, again, for dozens of years, and they do fine, or at least seem to do fine. Maybe it's affecting their health in the background. They don't know it. But again, it seems like, I mean, there are definitely people who have amalgams and they don't have overt health issues. But anyway, then there are others who do notice improvements after removing them safely. And I'll talk more about removing them safely shortly. But I want to now talk a little bit about root canals. So I'm not going to get into great detail. I can't say I'm an expert when it comes to root canals or even oral health overall. I do have on my podcast, I did an interview with my biological dentist, Dr. Eric Kempter. I think now it's been a few years, but Anyway, so definitely would check out that interview, and maybe you're seeing a biological dentist or will consider seeing one in the future who will educate you further. Because like I said, I'm not a dentist, but I think I have a decent amount of knowledge when it comes to oral health. But root canal, I mean, pretty much is just removing the nerve but leaving the tooth in place. And the concern is that potentially the bacteria remain trapped and over time can create chronic low grade inflammation, affect the immune system. Now, these days, there's ozone therapy, and a lot of dentists are starting to use ozone, especially biological dentists, but even some conventional dentists or some so called holistic dentists who are, I mean, just because someone says that they're holistic doesn't mean that they're a biological dentist. If they do root canals, then they're not a biological dentist. But there might be some holistic dentist who will say it's okay to get a root canal because we'll use ozone and the ozone will pretty much clear out all the bacteria. But there's no evidence that it does that. So I don't think there's anything that completely clears out the bacteria. And again, I'm not saying that root canals are always a problem. You always have to remove them. But I'm just saying that there's that. I mean, it's a good theory. I mean, ozone is. I received IV ozone when I dealt with chronic Lyme disease. I'm definitely not against ozone, and my biological dentist uses ozone. But as far as it wiping out, eradicating all the bacteria when getting a root canal, yeah, again, there's. I mean, like I said, have this conversation with a biological dentist, and they'll give you, I'm sure, a better explanation. But in any case, root canals are widely considered safe in general dentistry, but again, there are practitioners, notably biological dentists, who feel that they could be a factor in autoimmune conditions, including Graves' disease as well as Hashimoto's. So let's talk a little bit more about mercury. So mercury, again, like I said, it could impact the immune system, but also can impact the thyroid. And when it comes to antibodies, I mean, there's no guarantee that if you have, let's say, if you have one mercury amalgam, or even if you have 7 or 8 mercury amalgams, there's no guarantee that removing the mercury amalgam is going to lower your antibodies. But I have seen cases. Again, I've seen more cases where people just left in the mercury amalgams and restored their health and the antibodies normalized. So like I said, it's not like everybody needs to remove their mercury amalgams, but I have seen some cases where people's antibodies didn't normalize until they got amalgams removed. And I mean, if you do get them removed, you definitely want to make sure you go to a biological dentist or at least someone who's trained. It doesn't necessarily have to be a biological dentist. There's the IAOMT, International Academy of Oral Medicine and Toxicology, and they have a training, I think it's the SMART training, where so you don't have to be a so-called biological dentist to go through their training. And you could visit their website, again, IAOMT.org, and do a search and see who has gone through that training. And I'm pretty sure there are other types of trainings, but you just want to make sure that they take the proper precautions when removing the amalgams. But again, I think the evidence of mercury being problematic is pretty strong. I mean, there's not a lot of evidence directly showing that it directly triggers Graves or Hashimoto's, but it definitely can impact immune system. To me, it does seem clear that it could be a potential autoimmune trigger. And like I said, affect the thyroid as well as cause permeability of the guts. Really, there's no good reason to keep mercury amalgams in your mouth long term. Again, I know the concern is, well, if you remove it, there's the risk maybe of removing it and making things worse, but that's why you want to take the proper precautions. Now, root canals, definitely more controversial. So at least in the published research, not as much evidence when it comes to root canals causing problems when compared to mercury. Again, the biological dentist will provide, again, not published journals because they're just not there, but they'll give their perspective and what they have learned. And again, it makes sense. I mean, I had a root canal a number of years ago, and it wasn't really giving me problems, but I got it removed. I decided to get it removed just to play it safe. And it wasn't an easy decision because I didn't want to have, an implant. I did ends up getting a ceramic implant. Nobody wants an implant. Nobody wants to get a tooth extracted, and that's really the only solution I know of. Maybe in the future there'll be another solution when it comes to root canals. But yeah, so again, I chose to, and it wasn't an easy decision. Even with my background, it wasn't an easy decision to remove the root canal, but I'm glad I did it. Everything went well with the implants. I wish I did it well. Oh, I wish I got the root canal removed sooner, but after I got the root canal removed, when I saw the biological dentist, he recommended to wait 3 months before getting the implants, and I waited closer to a year just because I was dreading getting the implants, and it really wasn't too bad. It wasn't as bad, nearly as bad as I thought. So I wish I would have done that sooner. But again, I'm not encouraging you to, if you have root canal, to go out, rush to your biological dentist and get them removed. That, of course, is up to you, but just trying to at least encourage you to do more research on your own. And just, I will say this, that where I mentioned that I've had people remove their amalgams and that seemed to be the key in getting to remission. I haven't really seen that with root canals. I've had some people remove root canals hoping that would be like a big piece of the puzzle, if not like the main trigger, but I've never seen any patient of mine where they removed the root canal and that by itself normalized thyroid antibodies. So again, now it's not like I've had hundreds of people that I worked with remove root canals, but again, I definitely have had some, and maybe, like I said, if you speak with a biological dentist, they might have different stories, or you speak with other functional medicine practitioners, or go on forums or Facebook groups or whatever. But like I said, the evidence is definitely stronger when it comes to mercury, the impact that mercury could have on your immune system health, as well as on your thyroid health when compared to root canals. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. So again, it's all about risk versus benefits. It seems like everything comes down to risk versus benefits. So when removing, especially amalgams, if you have multiple amalgams, I mean, I've had patients who had like 6 to 8 amalgams removed, and it's pricey because again, they're taking certain precautions. So it's definitely more expensive than getting a regular, like just a regular filling, like just getting a mercury filling, like removing. Anyway, it's more expensive getting like a mercury, and I've only had one, thankfully, but one mercury amalgam replaced. But again, it was, I think it was like $500-600. I'm in North Carolina, and some places it will be more expensive. But so if someone has, let's say it's $500, and someone has 8 of them, so again, we'll talk about $4,000, and they're usually not going to remove them all at the same time. Usually they'll do, I guess, like 2 to 4. It depends on the dentist, depends on the person. But still, the point is it can be pricey. But I think it's something where most people are going to be happy that they did it. And again, I'm not saying you need to do it while restoring your health. I'm just saying in the future, let's say if you have 6 mercury amalgams and you're trying to restore your health, yes, ideally it'd be great to work with someone while restoring your health. But even if you make it a goal, well, I'm going to look to see if I could restore my health while not spending thousands of dollars to remove my mercury amalgams, but I'm still going to have a plan in place to remove 1 or 2 a year. So within a few years, I'll have them removed. I mean, that's better than not removing them at all, is my point. So some people certainly remove them quicker. And as soon as speaking with someone like me or someone else, another functional medicine practitioner, but that, like I said, that most people don't do that. Most people will keep them in and see how they progress. And so, but it's perfectly fine if you want to consider doing that later in the healing journey. Same thing with root canals. If you have one or more root canals. Again, like I said, it is more controversial. So I think you can make the arguments, well, do you really need to take the root canal out? Again, I took mine out. I got mine extracted and got the implants. But again, the implant's expensive too. The zirconian implant was a little more than $5,000. So again, if you have multiple, I mean, getting them one of those removed is bad enough, expensive enough. But if you have like two or three root canals and you're looking at $10,000, $15,000, and again, might be more depending where you live. Some places might be less. Also, should mention getting back to evaluating, like, is there a way to know if you're reacting to the mercury? And same thing, is there a way to know if you have an issue with the root canal? Well, I'll start with the root canal first. I mean, there's no great test. They could do like the cone beam, like CT scan. I mean, that could tell if you're infected, but again, there's really, yeah. So the technology still needs to be improved when it comes to root canal. So what mercury, now mercury, most tests that look at mercury, whether it's hair, urine, or blood, it's looking at levels of mercury. And just because you have high levels of mercury doesn't mean that you're reacting to the mercury. Now, again, it's not good to have high levels of mercury. So if you have high levels of mercury, it'd be nice to not have high levels of mercury. But there are immune system tests. One of them is Cyrix Labs, their array number 11, and that looks at the immune system reaction, not just to mercury, but other heavy metals and other environmental toxins and toxicants. And so if you were to do, let's say if you were to do a hair or urine test and mercury showed up high, and then you did Cyrix Labs number 11, and it looked great, like there was no reactivity. Again, to me, you still probably eventually should get the mercury amalgams removed, but maybe it's not as urgent. Whereas if you do that test, and again, I can't say I do this test on everybody, it's another pricey test. And again, I try to prioritize when I do the testing, but I'm bringing it up here. It's just so it's something you're aware of, and you could choose to do it if you want to. So if you show up with high levels of mercury on a test, and then you do the array number 11, and it is showing that you're reacting to mercury, that it is causing an immune system reaction, then you probably want to get the amalgams removed sooner than later. Also should add that testing like urine and hair especially are not perfect. Blood is different. Blood's looking at acute levels, but urine and hair, you could have mercury built up in the tissue and it's not really showing up in these tests. That's why with urine testing, some doctors do provoked urine, like pre and post provocation testing, where they'll give someone an agent, a provocation agent to take to mobilize the mercury from the tissues, and then we'll do another urine test, and there's controversy with those as well. But my point is levels. You can't always rely on the levels. We can make the argument everybody should do like an immune reaction test, maybe. Now, you got to be careful with immune reaction tests, because if you have lower what's called immunoglobulins, and you could test the immunoglobulins, but you could get false negatives with the array number 11. So again, work with a practitioner is what I would recommend before doing any of these tests, so you're not spending your money unnecessarily. And so that's, I mean, for the most part, that's what I want to cover. I mean, if your antibodies are still high, even after changing your diet, managing your stress, taking numerous supplements, that means that the underlying immune triggers are still active. And if nothing changes, those antibodies probably going to stay high month after month. I mean, you might see some fluctuations, but they're probably not going to gradually decrease and eventually normalize. And this is usually the point where many people with a natural mindset start thinking about treatment options such as radioactive iodine or surgery as the only path forward. But just remember that once you take that step, there's no going back. And if you rush into it, you can end up wondering if there was more that you could have done to avoid it. So just because you've done some great things for your health, yet haven't seen a decrease in your thyroid antibodies, now this doesn't mean that you failed, and it doesn't mean healing is impossible. It just means that you haven't found all the answers, and that you need a clearer way to look at your labs, your triggers, other factors, so you can make a decision you feel at peace with, and not one that's driven by fear or urgency. I think we could agree that most people in this position don't need more random information from the internet. You probably already know about diet changes, stress management, and labs. And if not, you could get this information from reading my books and listening to this podcast that you're listening to now. So what you really need is a framework, a way to put the pieces together so you can see whether you've truly explored all of the natural options before considering something permanent. And that's exactly why I created a focused masterclass. In this session, I'll walk you through the situations where permanent treatment like thyroid surgery might make sense and where there's more room to explore. A few of the most common triggers I see people miss, even when they feel like they've tried everything, as well as a decision checklist you could bring into your next doctor's appointment so you feel more prepared and less pressured. And the goal isn't to tell you what to do, it's to give you clarity, calmness, and confidence so you can make the decision that's right for you, not one you'll second guess later. And that's a big problem, again, especially with people with hyperthyroidism and Graves, just because radioactive iodine and thyroid surgery are commonly brought up by their endocrinologists. And unfortunately, a lot of people get these treatments when they don't need these treatments. And again, some people take a natural approach and maybe they're not seeing the progress and they end up getting these treatments. I mean, most people, of course, that get these treatments don't look into natural treatment options, but there are some people that start taking a natural approach and maybe they have unrealistic expectations, or again, that they might be doing some great things. And autoimmunity can be complex. Graves' disease could be complex. Hashimoto's could be complex as well. Even non-autoimmune hyperthyroid conditions like toxic multinodular goiter can be complex. So it's not quick and easy. But again, I've had so many people over the years receive radioactive iodine or thyroid surgery and regret their decision. Now, without question, there are people who they get these procedures and they don't regret their decision, but some people definitely do. So you don't have to wait for another appointment or another flare-up. So this masterclass, this is a recorded class. It's ready for you to watch right now. You'll find the link in the show notes and it will walk you through exactly what's included and how to get started. And so I'd like to thank you for taking the time to listen to this episode. And I not only look forward to catching you in the next episode, but I really do hope you take action and check out the masterclass, as you'll be so glad that you did.